Perfect. So hopefully you can all see my screen there. Hi, I'm Carl Relf from Cumbria County Council, and with me is Kate. Kate.
Good morning, I'm Kate. I'm the manager of the digital team at Cumbria. Carl's one of the team members. I'm going to let Carl do most of the talking because he's the one that's done all the hard work on this, but just as a bit of background and introduction to it, Cumbria have been using a low-code platform for the last, well, coming up 2 years now, isn't it, Carl? And we've been doing a lot of work to look at redesigning processes internally. Through the COVID stuff, though, all our resources have been pulled on to looking at various elements of supporting the COVID response. So firstly, vulnerable people, secondly, PPE, and then thirdly, the major piece of work that Carl's been involved in, which is track and trace. So I'll let him go through all of that. And if you've got any questions, obviously just type them in the chat or ask at the end, okay?
Perfect, thank you. So a little bit about myself first. My role is Digital Service Design Officer within the digital team at Cumbria. And that role really is made up of the 4 parts on screen, really. My background is more service design, service redesign. I wouldn't class myself as technical. So obviously the functionality that we have within Netcall and Liberty Create really benefits my role there. By no means am I a track and trace expert, so this has really been a challenging project to get to grips with. I've said many of times that if we're building a solution for when a request comes in and we have to issue something out, you can use your common sense, your initiative to know what agents need to see on the screen. Whereas track and trace, obviously, this is all completely new to me, and I'm almost relying on the service there to say what they need, and obviously try and help that. So really these 4 blocks on screen is where I spend most of my time now. The digital team that we have within Cumbria is quite a small team. There is predominantly 4 of us that work on Liberty Create, doing the service redesign and building solutions. And then we naturally have a split within the team where we've got ourselves, who are the service design officers, and then the web team, who are responsible for content on the web as well. So a little bit around the background, just as Kate said, really, we have been using Liberty Create now since around October 2018. Now, that initially started with Liberty Converse, so a telephony requirement within our contact centre. And since then, we've started to use Liberty Create more and more. Now, on the screen now, I've put a couple of examples of services that we've developed. So blue badges, waste permits. We've done a lot of work within highways in terms of permitting. We've redesigned our complaints and FOI procedure, and we've also looked at parking permits, to name a few. Now, they are just a couple of examples there. We've been sharing quite a lot of these applications within the Netcall community, which we'll come on to shortly. But really, what we've seen is that we are able to develop solutions within a rapid timescale. So on there, we've transformed services within 12 weeks. That example was specifically around blue badge. So we had a requirement to develop a blue badge system, and we were able to do that from initiation to development within 12 weeks. So the solution has really enabled us to push these services out and start to see some benefit from that redesign in a short period of time. But really, what we obviously have been able to do here is help to respond to the pandemic. So as Kate said earlier, we have developed a number of solutions to help with the response. And the first one of those was around setting up an emergency support helpline. So what we did here was we were able to set up a contact centre using Netcall telephony, using Liberty Converse. So we were able to establish a contact centre. We were able to develop a system where, using Liberty Create, where we're able to log requests from vulnerable people. So what we do within the system is we are able to log a request from a household, and we are able to capture their requirements. So they need food, medicine, or essential supplies. And then what we're able to do is we're able to match them up to support within the local community. So initially during the pandemic, what we were also doing was delivering emergency food parcels to these people. Now all of that response was coordinated through Liberty Create within this one solution. We then moved on to start looking at PPE requests. So again, this was a requirement for the contact centre where organisations were able to contact us and request PPE. Again, using Liberty Create, what we're able to do is we're able to develop a solution where those requests were captured and ultimately distributed and recorded within the solution. So we were able to manage the stock of that PPE within Cumbria as well. And then finally, the topic that we're here to talk about today is around contact tracing and outbreak management. So the contact tracing and outbreak management background, really, this has been one of the more challenging projects, and the background to that project, what we were starting with was we had an initial requirement. The service had contacted us and had said we need to set up a contact centre, so organisations, predominantly schools in the first instance, could contact us and tell us if they've got a positive case, and we would then be able to start to trace those individuals. So that's where we started. We started with this this contact centre. Now, to assist with that, the actual tracing was going to be done by an NHS team. The NHS team were actually responsible for sexual health and tracking and tracing those with sexual health issues. So what they had is they had an existing solution in place, which was an NHS solution. They had a vast experience and knowledge within the area. However, what they were unable to do was they were unable to develop their solution within the timescale required. So we were asking them, we'll capture the data within the contact centre, we'll hand it over to you, we'll give you the data and you can input it into your solution. However, shortly after those discussions, it became apparent that they were just not able to handle the data that we were capturing for them. We also had an issue as their solution, obviously the confidentiality there was the access was very, very limited. So we would be unable to access their solution. So again, we were risking having access to that data. So our scope started to increase at that point. Obviously, we knew that their solution wasn't fit for purpose. So at that point, we started to look at whether we could build something in-house as a replacement for their solution and cascade that to our wider partners. So looking at our experience from those projects that we've just discussed on the previous one around vulnerable people, around PPE, what we were able to do is we were able to develop a solution. Again, that was actually done within 12 days. So from initiation to having something workable within the services and across our partners, we were able to have a solution available. That included our Liberty Converse and Liberty Create. So we had the contact centre set up and sat on their seats ready to take calls. And we also had Liberty Create within multi-agency partners there as well. So what that system looks like, what we start with is we have a concept of we have the person. So initially what we were doing was a school was contacting the contact centre and they were providing us details of people who've had a positive test. So the contact centre are able to capture that detail from the school and are able to create a person. So within the solution, they start to create people records. So these are people who've had positive tests and we can triage these to the multi-agency partners to then start the next part of the process. What we then do is we capture the organisation that that person's related to. So this may be the example of a school. A school contacts us and says, I've got 2 people positive at our school. So what we do is we capture the details of the organisation and we create relationships to these people. So straight away, if we were to look at any school within the system, we can see how many people are associated with that organisation, with that school. What we then are able to do is our multi-agency partners are then able to contact each one of these index cases, each one of these positive people, and we are able to start to create links to contact cases. So this is the test and trace around, hi Carl, I can see that you've had a positive test. Who have you been in contact with? And we can then start to create relationships between my contact cases. And again, keeping our relationships through the organisation. If we're looking at an organisation, we can step through to the person, and then we can see from that person the number of contacts that that person has had. Now, the next level from organisation is what we are then able to do is we are then able to group or start to create an incident. So if there was a number of people at an organisation who were positive, and now again, apologies, I'm not a track and trace expert, so I'm not too sure in all the ins and outs as to when an incident would be created. But what we're able to do is we are able to create an incident and link an organisation to that. So the incident then groups together all of the people and the organisations through the existing relationships. And ultimately, if these incidents are to start continue to grow, what we're able to do is we're able to link those further and create an outbreak. Now, it's the incidents and outbreaks that have been discussed daily at the moment at our incident management hub. And again, with the way that we've built the system, what we're able to do is when looking at an incident, you can see a count of the number of organisations, the number of people, and ultimately the number of potential contacts that are associated there as well. So with setting our data up in this format, we're really able to drill down through those relationships and to identify exactly the scale of that incident or ultimately the outbreak. So just to confirm a couple of points there, our person really follows a process. So whenever we create a person, what we are doing is we're using functionality within the Liberty Create system where we're able to define a process. Now, what this process is doing is it's saying once we've contacted a person, we need to do these 5 steps afterwards. And having that within a predefined process helps us to make sure that we've got an audit log of all the times that that person was contacted. We can set things like follow-up dates. So now there's becoming a much more of a requirement to someone may not be positive, so we may need to continue to contact them on multiple days, and that predefined process helps us to do that, where we can track when and the number of contacts that each person has had. Also on the person, we're able to capture whether they're an index case, a secondary case, or a contact, and depending on that choice decides on the process that that person follows. And as I said earlier, we're capturing test results and we're linking to contacts also. On our organisation, we've got key contacts. We're capturing specific details around the school or an organisation. Specifically around a school, we're capturing how many students do you have, what sort of size of the classes, and also we're capturing those details. Once it comes to incidents and outbreaks, like I said earlier, what we're doing is we're capturing all of the people underneath that incident and outbreak, and we're able to do various things. We've got notebook functionality, so we can capture key actions. we can capture an instant owner and really have that one version. We're starting to see more and more now that there's spreadsheets flying around everywhere from, oh, we've got these actions. What we're trying to do now is get all of that information into the system, so all of our colleagues are able to see that. Now, one of the benefits also of using the Liberty Create solution is that we are able to develop a comprehensive reporting suite. There's a couple of screenshots on the screen here. Now, what we're able to do is we've done heat maps, we've published the number of tests that we've had done, we've published the number of interactions that we've had through the contact center. And what we've been able to do is we've been able to build this comprehensive suite of reports, which we can publish to users of the system, so they can really start to capture and see that big picture around what's actually happening in Cumbria. Now, what we've also been able to do is we've also been able to strip out some of that confidential data, and we've been able to make some of that data open to other colleagues as well. So we've got a core group of users of the system, and what we've been able to do is open that up to multi-agency colleagues as well, where within the security restrictions. So heat maps, postcode lookups, all this sort of thing has really helped to capture that data. And just a couple of slides towards the end here, visible results. You may or may not have seen that Carlisle had an alert published at one point. So again, this is a screenshot of tweets that have been published. Now, this data was all captured within the Liberty Create system. So within there, what the public health colleagues have been able to do is have been able to define this alert. We've been able to publish alerts to the general public to say, go and get tested. Here you can see the organisations that are affected, and obviously within the system we have got all of the detail around potential people here who were positive and their contacts as well. Following this alert, we had an increase of interactions to the contact centre, because the alert actually asked people to go and get tested, and as you can see, it's asking them to contact our call centre on this number. So again, we saw an increased number of demands. I think one of the mobile testing centres here in Cumbria had its busiest day the day after this tweet was published, and as such, people started to contact the call centre. We were able to log those people against the organisation, and again start to build up that bigger picture as well. So we really have been able to see it end to end. We've seen the incident growing, the potential for an alert, and then once that alert's been published, we've then seen the increased amount of interactions coming in and people being logged. And finally, just a little note around the positive feedback. There's a screenshot on the screen here now from our Colin Cox, who's our Director of Public Health. You can see there that we're saying around praising the team, praising our contact tracing team, environmental health colleagues around that. Now, where the system at the moment is being used by numerous of people, like I've been saying, we've got public health, we've got NHS using it, and we've also got our 6 district councils, environmental health teams using that system as well. And the number of cases that we're logging in there is growing. It's not necessarily growing around positive people, but it's growing around information around contacts, potential cause for concern as well. So, like I said, positive feedback received, and we've really started to see the benefit from that. And that is all of my slides. Now, we have also shared, been able to share our solution within the Liberty Create community, and I believe that's what we're going to be talking around next.
Well,
so I'll open the floor up to any questions.
Can you hear me?
Yes.
Smashing.
Yeah.
Smashing. Well, before we get any questions, let's invite another of our attendees who is also, I think, using Liberty Create at the moment, David Briggs. Good morning, Mr. Briggs.
Good morning.
I believe you're also at Croydon using the Liberty Create platform.
Yeah, we absolutely are. So, so I'm Dave Briggs, Head of Digital Operations at Croydon Council. We started to, we signed up to start using Liberty Create in January, and as part of our, we've spoken about this at other events, but as part of our response to COVID, we rapidly built out some applications using it. Our shielding case management system was all in Liberty Create. We also did a business grants discretionary fund application process thingamajig, and we also developed an internal SITREP tool so that for business continuity purposes, so that everybody in the council knew who was working when and which services were running and which weren't and all that kind of stuff. And it's fair to say I don't think we could have done any of that stuff quite as well or as quickly had we not had this tool available to us. So that was great. The other fantastic thing, though, as Carl was just alluding to, I previously worked with this platform as well while I was at Adrian Worthing Councils a few years ago, and Adrian Worthing have been doing some fantastic stuff alongside Cumbria and others, and like Cumbria, they're sort of starting to share some of the things that they've built in the Netcall sort of community on the app share. So these things take a number of different sort of forms, but the most exciting ones, I think, are the ones that are called accelerators, which I think is how the track and trace thing is shared, isn't it?
Yeah, it definitely is. Yeah.
Great. Which is basically you can just download the entire application and then start sort of bespoking it and customizing it to do what you want to be able to do. So we don't currently have a track and trace system in place. We're currently in conversation with the various sort of service areas to find out exactly what it is they want to do. But one of the first things we did do was download Cumbria's app and start sort of kicking the tires on that and hand it over to our devs so they can start having a play with it, so that we can understand what it can do and just how much time that's going to save us. And being able to do that is absolutely fantastic. So, and there's other stuff in that community as well. So again, Adrian Worthing uploaded, I think, a social prescribing app that can be sort of used and rolled off, and then also their sort of volunteer management stuff, I think, is up there as well, which is absolutely great. And again, we're looking at social prescribing as a key part of our sort of new model of operating, really, within the council, trying to keep people out of hospitals and out of care homes and that kind of thing, increasing individual and community resilience. So that's a great thing that we can do. And of course, the best bit is that it's this sort of real sweet spot in between sort of off-the-shelf software and doing custom development, which is that actually you can take something off the shelf, but you can still, as I say, sort of configure it and customize it to meet the local need, which is absolutely fantastic. But at the same time, saving a load of time, and more importantly, I think in this day and age, a load of money as well, which is always really, really good news, I think. And I think that on the broader point, a lot of us on this call are organisations would have signed up to the local government digital declaration and stuff like that, which is really hot on code sharing and things like that. And I think that the interesting thing, people talk a lot about open source and all that kind of stuff, and we do a bit of that because through our work around our sort of web content management system project, which uses Drupal, which is an open source thing, which we're releasing all the code for. That's all good stuff, but actually there's other ways of doing this, and that actually you don't necessarily just have to share lines of code and things like that. Actually, you can share whether it's sort of patterns or pre-built applications using low code platforms. It really is, I think, horses for courses in terms of picking the right thing to answer the right challenge, and there's loads of different ways that we can sort of contribute to that. So I think it's great. But as well as those accelerators, the other thing I just wanted to mention is that there's bits that sort of Netcall themselves are throwing in there, whether it's in the form of like plugins or additional bits of functionality that you can just pick off the shelf and whack into the applications that you're building out, which is really, really helpful. Obviously, there's no technology silver bullets; those things don't exist. But this hits that real sort of sweet spot between off the shelf, co-produced and shared across the sector, plus that ability to customize to meet local need, which is really, really important. And it's great that, I think genuinely that Netcall have seen this opportunity. They could have been nickel and diming us for all of this kind of stuff, but they've chosen not to, and I think that's terrific.
Excellent.
Yeah, I totally agree. And I think, Cumbria's, heavily invested in Liberty Create. And we know it's not the only solution out there, but for our particular context, with a very small team, with limited budget, the ability to share apps with other people, the ability to learn from what other people are doing in that community is something that's really valuable for us. So yeah, it's not a silver bullet, no, but for our particular context right now, it is the way forward,
Definitely.
Excellent. Well, thank you all. Thanks, Carl. Thanks, Kate, for sharing the track and trace journey. That's great.